Shadow Health Secretary Wes Streeting with us now. That number is going to go up.
Extraordinary. I mean, we've got the absurd spectacle today of the Prime Minister and other government ministers celebrating the 75th anniversary of an institution they have broken. And the fact is, Rishi Sunak, when he became Conservative Party leader, he said he would cut waiting lists, and they are rising and they are continuing to rise. And today he's, I think, looking to blame NHS staff. He's saying, oh, I'm going to really struggle to get these NHS waiting lists down because NHS staff are out on strike. And then you look at what Rishi Sunak as Prime Minister has done. Well, it is, but do you know, Rishi Sunak has taken the same degree of action on NHS strikes that he's taken on the Australians' foul play at the cricket, which is to say, oh, this is terrible. What's he actually doing? When was the last time he got the junior doctors or the consultants or even the nurses, for that matter, around the table to negotiate an end to this dispute? He acts as if he's a commentator rather than a leader.
Is the way forward.
I think he's got to knock some heads together. I think his health secretary is failing to negotiate an end to these strikes. I think they have badly underestimated the degree of palpable anger in the NHS workforce, not just about their pay, but actually about their patients and about the conditions they're working in. They're slogging their guts out, and they know that patients aren't getting good enough care through no fault of their own, and they are desperate for some light at the end of the tunnel, and the Prime Minister isn't providing it. He's acting as a commentator rather than a leader. And we've got to resolve the NHS strikes, but we've also got to make sure that in particularly this 75th anniversary of the NHS, that we've got a future to look forward to of both investment and reform to deliver the change and modernisation the NHS needs to be fit for the next 75 years. Because at the moment, the NHS is in jeopardy. I'm anxious about the future of the NHS, as I think the rest of the country is. And unless it changes, it will die. And yet the NHS founding principles, public service, free at the point of use, there for us when we need it, is absolutely possible for the next 75 years. But it needs the right leadership. And of course, I would argue, a change of leadership, a change of government.
Former Labour Prime Minister, as you know, Tony Blair, suggesting that some people should pay to use the NHS.
I don't agree with that. I mean, I think we've already got a two-tier system in this country where people who can afford it are paying to go private and those who can't are being left behind. In fact, that's one of the reasons I've said, and not uncontroversially, that if there's spare capacity in the private sector, we will pay for people to use it on NHS terms, free at the point of use so they don't pay a penny. Where I want to get to, if I'm the country's next health secretary, is an NHS that's so good that no one feels forced to go private. Because that's what the last Labour government did, ironically. You know, use of the private sector fell off a cliff after 13 years because we delivered the shortest waiting times and the highest patient satisfaction in history. So, of course, people said, well, why would I go private? The NHS is there for me when I need it.
OK, so you completely disagree with what Tony Blair is suggesting, that people who can afford to pay should do that in order for to free up capacity for others?
I do, because I think that an NHS that's publicly funded, free at the point of use, is the fairest and most efficient way to organise a system. And if you're wealthy and have the ability to pay more, then the tax system can do that very efficiently and effectively. And when you look at Labour's policies, I mean, we're not, we've taken some flack for this, but I think we have rightly not made loads and loads of spending commitments because we know the public finances are in a mess. Where we have made spending commitments, we have gone for fair sources of raising the money, like abolishing the non-dom tax status, because we think wealthy people who make Britain their home should pay their taxes here too. So I do disagree with Tony Blair on that. He's got some other interesting ideas he's put out today about how we can use data and technology more effectively to give people a really personal health service, to organise resources in the system more efficiently and effectively, and to liberate the poor NHS workforce from the creaking IT systems that make their everyday work and productivity an absolute misery. And, you know, patients can see it too. How many of us have had a letter in the post telling us that our appointment is cancelled the day after we turned up for it? We've got plenty of examples of the way in which we see the NHS inefficiency. And I think there's something in that. But the idea that we would pay for the NHS through user charging, I mean, over my dead body, frankly, and there are plenty of Conservatives who are making that argument at the moment, I will not compromise on the principle of an NHS that's free at the point of use.
And to be fair, the Health Minister said that as well. Speaking of people with plenty of money, Coutts, the private bank, apparently in order to have an account with them, you need to have £3 million deposited.
Oh no, that's me priced out.
And they say that's why Nigel Farage does no longer have an account with them. We've heard the Chancellor.
Shall I get my world's smallest violin out for Nigel Farage not getting his Coutts account? You can bank at NatWest or HSBC like the rest of us, Nigel. Sorry.
Do you have any sympathy though for? I mean, he's suggesting it's about free speech. I've never known you.
Where do you start? Where do you start?
Words.
And to be honest, I literally do not care about this topic. I mean, I always like to come on your programme and answer questions. I literally could not care less about Nigel Farage's banking arrangements. I do care about the people who can't afford their mortgages or can't afford their rents or are getting to the end of the month and are in their overdraft because they've got more bills to pay and they've got money coming in. That's most people's experience. But Nigel, if you're watching, I'm very sorry, but I will be shedding no tears about you not having £3 million to deposit in a Coutts bank account.
But it goes to a wider subject, a wider point, which is he says 8 banks have said that he can't have an account, and he says it's because of his political beliefs. People should be able to bank, even if you don't agree with what they're saying.
Yeah, I think that's a different issue. If people are being discriminated against in terms of their banking because of their political views, well, that's a different kettle of fish. And actually there, I would say, despite strongly disagreeing with him on pretty much everything, that would not be appropriate for him or anyone else, actually. But yeah, I must say, I literally don't care about Nigel Farage's bank accounts. I'm sorry.
What you do care about, very briefly, is your new book. It's got a funky title.
One Boy, Two Bills and a Fry-Up.
Tell me why.
One boy is me, 2 bills are my very different granddads. One, very straight-laced, pull yourself up by your bootstraps, working-class Tory. The other, an armed robber who's in and out of prison throughout my mum's childhood, my childhood. Very different characters. And the fry-up is literally the fry-up that saved my life because my mum was due to have an abortion. She was 18 when she was pregnant with me. The appointment was booked. She decided not to go through with it. And so on the day of the termination, she did what she was told explicitly she could not do, which was have breakfast. She cooked herself a fry-up, and that way she couldn't be frog-marched down to the hospital by my nan, who was absolutely apoplectic that her daughter was having a baby. And I sort of understand, given that I'm 40, my nan was 41 when I was born, and I can understand why, as a 41-year-old woman, she didn't necessarily want a grandchild, even though she was delighted when I arrived.
Wow, we want to talk to you about that book in more detail, but sadly not today. Another time, hopefully.
Yeah, thanks, Kay. Thanks for having me on.